We were just trying to think about what has already been done in this field, because we knew we weren't the first people to think about this issue, and we thought we'd gather that information because there were some important lessons to be learned from past efforts, right? And so that's what I'm going to speak to you today about. And I imagine there's some of you who have some knowledge of some of these initiatives, so it'll probably lend itself well to our discussion now and in the afternoon about what some of these initiatives had to offer, what they found, what they recommended, how far they went with change processes. For me, it's a new endeavor to go through this kind of archival kind of processes, and one of the things I've learned is how challenging it can be. Fortunately, I had the assistance of Andrew Posen, who is a graduate student at Della Lana that I mentioned earlier today, who helped us with this project pretty much full time for about 6 to 8 months, and because there was a lot of digging to be done, as you can imagine, pre-computer and website periods from the 80s and 90s kind of thing. So I think one of our successes is just having to amass all of this really rich reports and information, and then supplement it with some interviews. So it was a collective effort. You know, there's a number of people listed here. Some of them are here: Alec Farquhar, Sherry Torshman, Ellen McKecken. We're all very actively involved in this initiative, and can speak to some of the things that we discussed in our team meetings, and what we've uncovered through this archival retrieval process. So the objective of this study was to identify and describe past policy efforts. We call them initiatives. You know, I struggle with the right term for some of these things, but I'm going to maybe call them initiatives, to address the issues related to coordination and navigability, the two key things we're talking about today in this policy roundtable, of the different disability income support programs in Canada. So actually this follows up very well with some of the stuff that John Stapleton was showing in previous presentation. And his name comes up a lot in some of this work as well. Motivation for this piece was the central part of why, not the only piece, but why we went about this initiative, because we realized the complexity of the system. Myself and Ellen come from more of a workers' comp paradigm, that a lot of the people we were engaging with in the community, Steve and others, were pointing out the fact that a lot of people fall through the cracks in regards to what system they start off with, and navigating the system is a challenge in and of itself, and even knowing of the existence of some of these programs is not commonplace for a lot of people in the disability community. So it was one of the themes that we identified early on in our decision to try to put together a partnership grant and seek funding through SSHRC to address the broader disability policy system. So navigation and coordination navigation, it was key theme in our upfront for our initiative. As I mentioned, it's been broached by many others under the banner of what I describe as initiatives, and so we really felt a first endeavor for us, as not the only one, but one of the early on things we wanted to do was really explore what has been done in this area, who was involved, see if we could track some of those people down. So we had some successes and some not, because some of these initiatives were from the 90s, and those people have retired or gone elsewhere. But we did manage to track down at least one or two people for each of the core initiatives that we were looking at. Trying to think about how it was framed. There's a little insert for today's package about different notions of coordination and navigability. One of the things we realized quickly was people interpreted those terms in different ways, and so that's some of the things we may want to discuss here, as well as what does that actually mean. So how did they frame it in these past initiatives? What were their recommendations, from their efforts in their initiative to advance policy? What, if any, were the changes that they made? So these are the kind of things we were trying to explore. So one of the things I want to point out is that we had a last-minute insert for the for the packages, and there's some extra copies if you didn't get it. It's just a list of all of the initiatives that we had identified in this project. It's not critical that you have it on hand, but it's also available on our website, and I'll talk a little bit more about some of the resources we put on our website to look up some of these initiatives, the documents and reports that were associated with them, because they're not always readily available. As I mentioned, some of them are preclude PDF files, which we did actually PDF if they were just in print form. Okay, we saw this diagram already, so obviously this is just at the center of our issue, that the complexity of the program, many different programs out there, the complexity of the system and the many different programs out there. How do you maneuver through those different programs as a person who needs support when disabled to continue engaging in the labor market, to get back into the labor market, and other kind of financial support you might need in the interim as well, whether it's short or long term, is a huge challenge for many people who are confronted with a disability, whether it's later in life or early onset or congenital. Two recent reports that we've put up in the roster of archival material that we have identified is one of them is an issue briefing from the Institute for Work and Health. I'm not expecting you to read any of that print there, just what you visually see from it. It's an issue briefing that John Stapleton put together along with who was the other author? I don't recall. Stephanie. Yeah. So, and that's available on the IWH website, and it speaks to the complexity of the programs in a short, I think 4 or 5 page synopsis of describing these different programs and the patchwork quilt of disability supports and navigating the navigational issues kind of thing. So it's a really good summary document. And it's available on our website. It's done a few years ago, in 2010. And then we all know also probably the report that was done called Sickness, Disability, and Work, Breaking the Barriers, which is one of a number of OECD reports summarizing disability systems in different countries, and this one's focused on Canada and speaks to some of these issues as well. So those two, we have links to both of those on our CRWDP website. So defining coordination and navigability. So let's try to start to think about, it may not be comprehensive, it may not encapsulate all of the things you might think about when you think about those two terms, but the starting point for our project was coordination being defined as the way different programs interact, and navigability as the ease with which clients can identify the programs most suitable for them, as well as move within and between programs when their circumstances might change. So just a starting point to try to give some, kind of framing around those two concepts and to think about the kinds of issues we want to pull out of those initiatives that we are looking at historically. Some of the initiatives were more complex and addressing multiple issues, but we were trying to focus on the coordination, navigability, that's a tough one to say, issues that were addressed in those initiatives. Right. So. And then there's different ways that you might speak to coordination and navigability in terms of trying to improve the system, right? So one of the possibilities, and it's spoken to in some of the initiatives, is just have a common access point to help identify the client's needs and point them in the right direction, right? So, rather than you separately going to each of those programs as a client looking for the supports, to go to one place and somebody helps navigate, takes you through the system of finding what works for you, what's right for you. It could be even the coordination of the application process, possibly to reduce administrative load and waiting times. Each of these systems, as you can imagine, has different application processes currently and different criteria and different waiting times. And so if you're sequentially accessing these to try to find the right place, it could take a few years. Common definition of disability that minimizes the need for multiple assessments. So I think that's been spoken to already through some of the things that Ellen presented in our first presentation. There's different ways of defining disability, and these programs, both the literature but also the programs, define disability in different ways. So eligibility in one program doesn't necessarily mean you're eligible for other programs, even if you have, they're designed to help people with those kinds of conditions. The criterion, the assessment process may be all different. It also may be about assisting clients who access two or more programs at the same time or sequentially. So it's not uncommon from our discussions with community members that they do at times access programs concurrently and sometimes sequentially. And the way these programs work, not speaking to each other, you often see, and it's been mentioned by a few people, you get clawbacks. You get an increase in one program, it's clawed back by another program, and the net change for the client is zero oftentimes, right? And so the lack of coordination doesn't serve anybody well at the end of the day, and a lot of duplicated efforts. So this is kind of the framing of why we're here today to discuss some of these issues, but also what we're looking for to better understand what past efforts have been done to address some of these issues. And we were probably familiar with these by now. Some of the challenges associated with that. These programs all have different histories. Workers' compensation has probably the longest history in Canada, back from to 1910, kind of thing, as a social safety net program. Their mandated focuses are different. Originally, at least, they were meant to serve different clients and different needs. They're administered at different levels of government, obviously, and by different ministries. Some of the programs are contributory, so the user has to contribute to be eligible, the employer has to contribute to be eligible. Others are not. They're from the general tax coffers. So and then their funding sources as a result of that are different, because some of them are contributory and some are not. Some of the possible benefits of thinking about coordination, doing a better job of that, and improving navigability is reducing waiting times, improving access to the needed supports, the right supports, greater assurance that the clients access the most appropriate program. So what is the most appropriate program? Some of the stuff that John was showing us earlier in his review of what's happening across the programs across Canada comes to question, are these people accessing the right programs at the right time, kind of thing. Increased equity for clients, people who have equal needs or in similar situations. We'd want to treat them equitably. And then on the win-win side, maybe in terms of costs, administrative-wise, there may be just increased efficiency as well in the administration of some of these programs. Because you can imagine the cost of duplicating these evaluation processes time and time again across the different programs. So our criterion for inclusion of an initiative, as I describe it, that was in scope for our scan, was sort of developed as we were moving along, because we realized the complexity. We knew it was complex at the beginning, but we realized the complexity of how some of these things even get packaged in different policy initiatives with other kinds of issues as well. Poverty and a more broader umbrella in some of them, access to various government services and others, not just issues with disability and things like that. So we need to think about, what's in and what's out in terms of our core area that we want to explore in depth, our core initiative. So first of all, we want to think of it as a group of people working together on most cases from the policy arena, from the government sector, working together on a mandated duration and outcome. So they had been given a task to address a certain perceived need that needed change, some policy changes or things of that sort. That change or that mandate had to be about improved coordination within Canada's disability income system. We were focusing on the income side rather than the other disability support side, though sometimes it wasn't always clear in some of these initiatives that some of them were packaging disability support needs more broadly, so that wasn't always completely clear how broadly it was cast, but at least I had to think about the income support needs that people with disabilities have. And with a goal for making recommendations going forward. And then they had to have an express objective of influencing policy. Seems kind of fussy, but otherwise it's really hard to discern what's in and what's out. And particularly a lot of academic initiatives like our own, there has been CURAs from SSHRC addressing some of these issues as well. Do we include that? There's policy think tanks like Caledon. Do we include that? There's larger institutes for work and health type activities that we do. Do we include that? So to package it up reasonably tightly, we want to focus at least on some key ones that fit these criterions to think about. Well, what were the issues they were grappling with? What did they identify as possible solutions, what were the recommendations, and how far did they get with implementing them. So we consciously excluded some of them, particularly the academic and policy think tank type initiatives, though we do have a lot of documents available on our resource on crwdp.ca that are from these various organizations in academic endeavors. So our approach to kind of getting familiar with what those initiatives were about were two-pronged. We did a very extensive grey literature search, reports primarily in policy documents, historical policy documents, identified sometimes through the assistance of key informants. So we really reached out to our CRWDP network of academics and partner representatives and to help us identify some of these documents. So these key informants are just individuals who might be familiar with this subject and the history and have had some involvement in the system. It really was a sort of a snowballing approach that we took because we were just exploring at the surface, at the front end, and digging deeper as we saw interesting things to pull out more documents, oftentimes gathering extra materials that were reported on in the core documents we identified at the front end, and people that were mentioned that we tried to link up with to help identify more detail about these things. The second part of the two-prong approach was doing some semi-structured interviews, seeking out individuals who are involved in these initiatives. So as I mentioned, some of them have retired since, and we managed to track a number of them down to help speak to the details that might not come through very clearly in those reports, the publicly available documents, to get a better sense of what maybe the insider scoop is about, what were their barriers and struggles, what did they think really worked well, and things of that sort. These interviews are actually recorded and transcribed, and we've been starting to do some thematic analysis and content analysis around some of the key issues that have come up in those interviews. And in a few cases, people didn't want interviews recorded, so we just took detailed notes during the interview. So this is a list of some of the policy initiatives that we identified. There's 14 of them, as you can see on that slide. And I'm not going to speak to all of them, so don't panic. I pulled out 6 of them that we thought really fit those criteria and that we talked about, and they're highlighted in that darker blue. I'm not sure if that shows up on the screen. That I'm going to speak to a little bit because we felt that they had at least a key component of what they were doing was about coordination and navigability. Sometimes their scopes and mandates were broader, but at least had a core component that looked at some of those kinds of issues as it pertains to access to programs for people with disabilities. And there's people here who probably have, as I mentioned, a lot of familiar with some of these past initiatives, and hopefully we can have a good discussion about their understandings or collective understanding of what went well there, what worked, what are the challenges and barriers to improving, coordination and navigability. So, but I'm going to just go through those 6 highlighted ones in just a little bit of detail to give you some insights about what we understood about these programs. Just to add a little bit, there was also some other items we identified, think tanks and research initiatives that we've also put that material up on our website. And there's actually the URL. We can give that to you, in a way that you can click on and link up with it if you're interested in accessing some of those documents. We scanned anything that was just in paper form and into PDF, and it's a huge plethora of resources around each of those 14 initiatives and these other 4 that we've listed here. So, going into those 6 initiatives, what I'll talk about is their motivation, why they was thought to address this issue at that particular time, a little bit about what they were mandated in terms of objectives and goals that they were trying to achieve, some of their activities within the context of while they were working as an initiative, and maybe also what happened following their reports and recommendations. And then some of the uncovering of some of the barriers and facilitators, either directly through the reports, as if they documented that, and through the interview process that we had through the key informants. So the first one in my list is the Federal Task Force on Disability Issues that happened in the mid-1990s. It was a Government of Canada task force. It's sometimes known as the Scott Report as well, the report that came from that. had some motivation that maybe originated from efforts that were done prior to its initiation in the 80s. Between 1981 and 1995, a lot of reports had been done by the federal government on this issue of access to supports and benefits for Canadians with disabilities. In 1981, I guess it was the year of people with disabilities that initiated some of the thinking around these issues, and an obstacles report was produced at that time in 1982. And then there was a number of pieces of work that followed that. But one of the frustrations was that there was a lot of report writing, and maybe sometimes a perception that there was a very little action on those reports. So this effort of this task force was to try to make change or in addressing some of those issues and trying to identify how to prioritize them. So the task force was jointly commissioned by the Ministry of Human Resources and Development Canada. I'm not sure if that was the name at that time. And again, I'm too soft-spoken. And the Minister of Finance and the Minister of Justice and the Minister of National Revenue. So collective effort across different ministries to try to address this issue in this particular initiative. The objectives and goals of this initiative was to determine the federal government's role in addressing disability issues, to help identify also a vision to promote inclusion of people with disabilities in Canadian society. So it wasn't always just about work. And to use this vision to make some general recommendations with specific action plans for the short, medium, and long term. So this is how it was encapsulated across the documents that we could identify related to the Scott report. Okay, activities and outcomes. A key feature of the way they went about this was they actively included people with disabilities as members of the task force, and that's really profiled as being a real successful aspect of this effort was having them involved and making the people who are on the task force very much aware of their experiences. There's commentary that we've come across about, when they were traveling to different parts of Canada, some of the struggles they had of getting the services needed for some of the people who are on the task force, and realizing firsthand some of those struggles for people who don't have disabilities, waking up to the fact that traveling on a plane, if you're in a wheelchair, was very limiting in rural areas where only small planes can access some of those locations and things like that. So what they did was they conducted 15 consultations across Canada and involved 2,000 participants with disabilities. And the report that was produced from that is called Equal Citizenships for Canadians with Disabilities, which outlined 52 recommendations. And I'm just highlighting here the key ones was moving towards a comprehensive disability insurance program covering all Canadians. Giving programs better mechanisms to improve workforce participation. Reconfiguring programs with consideration of the tax system and the cost of disability. So those were the key ones that relate to the kind of things that we were interested in. Several legislations, policies, and programs did change and were enacted as a result of that effort, and the report documents and details some of those changes that were happening. Some of the barriers, and also maybe facilitators, were time and timing. One of the key things, and this comes up a lot through all of the initiatives that we're looking at, is change takes time. Particularly when you're thinking about the magnitude of changes that we're thinking about here, when you cross ministerial boundaries, you cross governments from provincial to federal, and much like we talked about academics and some of the people, our partners being very siloed, and governments can be like that as well. The ministries operate very independently. So the structure of government can sometimes be a key barrier. Systems coordination requires obviously coordinating across, as I mentioned, ministries and governments. Financial constraints are obviously a key issue that comes up all the time. The focus of the day at that time, and this is the mid-1990s, was on cost cutting and getting rid of the deficit, right? So to think about initiating a big change in how services are provided and coordinating across ministries is quite an undertaking, and so that was a key barrier for them at that time. One of the things, though, they said was having a respected champion spearheading the initiative really made a difference. And that's part of why we in our initiative are trying to identify champions for CRWDP as well. And Andy Scott was really, I'm told, passionate about this issue. and really took it to heart that he really wanted to make change for people with disabilities. So that really was a really positive thing for that initiative and the people involved in it. The second one I'm going to speak to about is, and some of you might know this, Service Canada, Human Resources Development Canada initiative to coordinate better the services for people with disabilities and more broadly other services as well. The motivation was realizing that services were really complex when you're viewing it from the client-based perspective of trying to get access to some of these services, and if you drew a map of all of the different departments and programs and stuff like that with where you go for what, that you get that messy spider diagram, as they call it, that was created by the HRSDC staff to highlight that complexity for the public and the policymakers and everybody, to realize that this is not really doing anybody any good, having to go through that mess of trying to seek services. And there was also some political pressure for change as well. So that was another key motivator identified by one of our key informants. The objectives were to improve coordination of federally administered income support programs, among them other programs as well, not just disability support. From both a service delivery perspective as well as a policy perspective. So reshuffling, I guess, it would be required in how these services are delivered, in terms of combining efforts from different departments and service providers within the public sector in order to get rid of some of that web mess of spider kind of things that are happening there. So some of the activities and outcomes, it took about 4 years of planning, I'm told, to a lot of scanning about best practice both nationally and internationally, consolidating some of the stuff with call centers and office spaces and training staff to be more broadly being able to provide those services across a range of supports. It brought several services for Canadians with disabilities together under one roof under Service Canada to improve access and delivery. And maybe you guys can speak to about how well that and successful that was and what it looks like today. Barriers and facilitators, one of the key things, and this comes up again, convincing of heads of federal government departments to embrace removal sometimes of some of their responsibilities. Oftentimes we have this turf and status of, this is my program, I'm responsible for it, I can't give it up. Sometimes, one of the things we came across, somebody mentioned that, your salary and your status within the organization, ministry, may be based on how many people report to you. So if some of those people are removed from your direct responsibility or share responsibility with other people, then there can be a turf war there. So just the time it takes, again, I mentioned time to convince bureaucrats that there are better ways of doing things it's not just, it's true in all organizations to varying degrees about that turf war and status that you have of having a large group of people that you work with that report to you if you're managing a certain area. And mentioned by one of the reports we're looking at that they're kind of purpose-built to maintain those silos. One of the things that actually facilitated this process, so I understand, is just that was the dawning of really internet and technologies coming on stream that really helped facilitate this change. So, it couldn't have happened in the mid-90s because the technology just wasn't there to offer that possibility. Okay. Another one, listening to Canadians. This is Longfield and Bennett, were the key authors of this report. The Government of Canada Subcommittee on the Status of Persons with Disabilities, happening in early 2000s. The motivation was that many federal MPs were receiving visits, we were told, and correspondence from their constituents regarding the operation of the Canada Pension Plan Disability Program in some of its shortcomings. And this is directly quoted from the Longfield and Bennett report. And also it mentions that it's been a long time since a parliamentary committee had examined in any detail issues related to the Canada Pension Plan Disability Program. So this subcommittee was struck with the objective to give the federal government a better understanding of how the rules and regulations surrounding this CPD program impacted people on the ground floor. They were consulting with people with disabilities and others in the field to inform recommendations pertaining to the program and its interaction, particularly with other programs as well. So again, the interaction issue comes up in this initiative, and that's why we found this particularly interesting. In terms of its activities and outcomes, it held actually one of the first online public consultations in Canada. So that was one of the kind of, I guess, maybe a technology thing that also assisted that. Attracting about 1,500 responses to an issues poll, 135 stories were given of people's personal experiences, and 28 recommended solutions were proposed related to the CPPD benefits. Actually produced a report with 53 recommendations. 6 really were relevant to coordination issues between CPPD and other disability income support programs. One of the things they recommended, we've talked about it already today, so it's interesting to see other people have been down this path already. They recommended standardizing the definition of disability across all federal and provincial programs. They did also receive an official response from the Government of Canada, a commitment to give to one of the recommendations in particular. So there was a documented response, which is also in our archival material, but it didn't get very far in that time period for a variety of reasons. And some of the barriers are accountability and priority setting and time management issues really posed a key barrier. An earlier report prior to this one actually noted the disability issues span governmental departments, as I've mentioned a few times now, and ultimately are unaccountable for failures to coordinate. So who is really accountable when coordination doesn't happen? You almost need a minister of disability policy issues who could oversee the cross-cutting issues across ministries. And the subcommittee was dissolved when the Liberal government fell in 2006, so obviously it didn't get very far after that. Here's one that's very provincial, and this is representative maybe of things that are happening across various provinces, but we pulled out this one from Newfoundland and Labrador. Particularly, did I say that right, Stephen? Newfoundland? I used to say Newfoundland. So Newfoundland and Labrador.
That's the only wrong way to say it.
On the poverty reduction strategy, because it had a lot of elements of coordination issues that spoke to the things we're talking about today. So motivation was actually an election promise to address poverty by the Progressive Conservative Party that actually won the elections following the campaign, and before winning the campaign, Danny Williams had mentioned the issue of poverty, that he was going to address it and make huge inroads into reducing the levels of poverty in Newfoundland, which were the highest levels of poverty in Canada, and then he had said he would make it one of the lowest in Canada. And one of the things that was noted in one of the documents we were reading is that poverty issues were very apparent during that election campaign when a lot of new progressive conservative politicians were campaigning door to door, when they saw at firsthand the state of certain people's existences and the needs that were unmet across a number of their constituents. So it was very front and center in their eyes when they first took office, and the promises made as well during the campaign to try to address these issues. So the objective or goals of this initiative were transform it from the province with the highest poverty rates to the lowest poverty rates over a 10-year time period. And 5 goals were identified in a strategy document, 2 of which pertain directly to people with disabilities. And what they talked about was improving access to and coordination of services for people living on low income, as well as those people with disabilities that are low income, and creating a stronger social safety net by, among other things, to increase disability supports that will help people with disabilities participate more fully in communities. So even though there's poverty reduction strategies in the other provinces, this one really spoke directly to this people with disabilities and coordination issues across programs. An interdepartmental committee was struck to examine these issues. They did consultations, as is a common practice, consisting of 22 workshops, focus groups, and phone and mail contacts. They produced a poverty reduction strategy document with 5 goals that were really key to what we're talking about here. One other thing they also did was they developed their own measure of, and I don't know too much about the details of it, but their own measure of poverty that combines impacts of that they use to analyze the combined impact of their poverty reduction programs. So that's sort of another unique aspect of this initiative. And in 2012, from documents we've gathered together, Newfoundland was the second lowest poverty rate in Canada, in line with Saskatchewan, and just below PI. So barriers and facilitators, departmental prioritization can be a barrier. No one branch, again, like we've talked about, addresses these kinds of issues uniquely, kind of thing. So we're having to straddle different departmental programs. At one point we were told also that the strategy was stalled during a core mandate review. So when people are obliged within the ministry to focus on the core mandate, that was kind of stalling it for a little bit. Champions obviously make a big difference. I keep mentioning that. The Premier himself had talked about it being a campaign issue that they were going to make good with on their promise. The Minister of Finance was directly involved in the committee, so that helps a lot too. To facilitate making change, right? Observing firsthand the lived experience of the constituents is also a key thing that was mentioned by a few people and in the report. Connecting the community groups and the stakeholders during the review process was really important. So really community engagement in the process, again, was a really critical thing. One other thing that was been mentioned by one of our key informers is also maybe the small size of the province helps facilitate more directly coordination issues than when we think about the complexity of federal versus provincial and larger size provinces as well. So that possibly helps put things into action a bit easier. The fifth program is a very focused one that John Stapleton may know about because he's one of the authors of the report, Navigating the Maze. It's a report done by the Canadian Working Group on HIV and Rehabilitation. But it speaks broadly to issues of chronic and episodic disabilities, and that's the direction a lot of this work with that group has gone since this report as well. So motivation was the treatment of HIV and AIDS has become more effective and accessible, leaving many people with episodic disabilities rather than a terminal illness. So what happens in the long run in their lives when they have this disability that's episodic, at times it's very serious, sometimes it's not so bad, and they're able to work intermittently. And what happens to that kind of trajectory of lived experiences in terms of ability to engage in the labor market? Most disability programs provide low levels of income, are uncoordinated, and measures to prevent the pursuit of paid work during periods of wellness, right? So, just restrictions on ability to work, clawbacks and things like that, discontinuation of benefits if you engage in the labor market, things like that. So it really doesn't lend itself well to the notion of episodic and chronic disabilities. It's more of an all or nothing kind of approach with most programs. So the objective of this initiative was to promote opportunity for optimal labor force participation for people living with HIV and AIDS through security and continuity of the needs and supports that they had. The implicit goal obviously was about interaction of different programs with earned income in particular. Some suggestions of also extending EI sickness, because one of the key issues with the programs is there's no in-between program. We have EI sickness for 16 weeks. After that, it's one of those other programs that are all or nothing. But what if you're off work for 6 months or 12 months, but can go back after that? There's not a real program for the intermediate stages of an episodic or chronic disability. And changing the definitions to a more person-centered approach that accommodates this notion of chronic and episodic disabilities. Ultimately, to bring the issue affecting people with episodic disabilities, they were hoping to bring it to the Council of Federation, a group of Canadian provincial and territorial premiers that meet annually, which actually they ultimately were not successful in doing. So they identified 5 key areas needing solutions. The definition of disability obviously was a key thing for them. Duration of disability was another issue as well. If it's a period of more than a few months, you need some intermediate stage, but you may be able to get back to the labor market afterwards for a period of time. Adequacy of benefits, workplace concerns, and communication of the issues as well. It helped start people talking about the lack of coordination as well, they report, and drew attention to the way disability income supports affect people, particularly with episodic disabilities such as HIV and AIDS. Barriers and facilitators, well, they didn't have very long-term funding. They had a piece of funding from the Public Health Agency of Canada and some other funders as well for a period of a year or two, and after that it was, that funding period ended, so they couldn't continue their work. The complexity of episodic disabilities, which was a big theme in our initiative as well, is how do you speak to the reality of the fact that a lot of people's disabilities are not permanent and long term. They are long term, but not permanent and constant. But they change over the year, over the life course, and people can maybe be able to engage sometimes, but not all the times in the labor market. Cost constraints, the expense of re-engineering came up as well. And then they also didn't have a champion who could take it to the Council of Federation. So that was one of the things one of the informants mentioned. The last one I'm going to talk about is a very recent one for Ontarians who might remember the Commission for Review of Social Assistance here in Ontario. It had an element to it as well about coordination across other programs, even though the key focus was our ODSP program. There was some element of how that program speaks with other provincial and federal programs. So, it was part of the Ontario's 2008 poverty reduction strategy mentioned there to do a review. Possibly there's some mention by someone about a political effort to appeal to left-wing Ontarians at the time, because a report called the Drummond Report, you might know about, had more of an appeal to the right wing, so trying to encapsulate the broader spectrum of constituents in Ontario to appeal to left and right. The objectives was to develop specific recommendations and concrete action plans for reforming social assistance systems to improve client outcomes. Give advice on how to establish an appropriate benefit structure, simplify the social assistance system, provide support for labor market engagement, which the program didn't seem to do very well, ensure system sustainability, and then identify Ontario's role in providing income security relative to other programs, particularly at the federal and municipal level. Activities and outcomes, it produced a report that's available on the internet with 108 recommendations, none of them which relate particularly towards coordination and navigability. Instrumental in raising the rates for, we were told, in single individuals without disabilities and receiving Ontario Works program, but not very instrumental in some of the other recommendations. Some small steps, we were told, were taken to address dental, pharmaceutical, and health benefits to low-income Ontarians. One of the key barriers that was mentioned by one of our key informants was the vested interest in the status quo from both the recipients of social assistance concerned with sweeping changes might being detrimental to their the benefits that they're currently receiving being an issue. Also politicians and policymakers being reluctant to institute any kind of large-scale changes due to the complexity and obviously a lot of downside risks if it doesn't work. And we've had those kinds of things happen in Ontario in the past with other initiatives. It really looks bad in the public eye. We've, as I mentioned, we started doing some analysis of the interview data and the documents as well, and using the Advocacy Coalition framework. We're examining how policy changes happen in situations involving multiple actors, conflicting goals, and different understandings of or access to technical information. We look at it sort of at the macro, micro, and meso level as foundation stones. And so some of our analysis we're going to go forward with is trying to dig deeper in what are the key issues at those different levels. And I'm just going to summarize with a few of them in my next slide. So at the macro level, systems coordination was coming up time and time again. Coordination requires government ministries to coordinate across their mandates. So this is the biggest challenge, is that issues spread across these different ministries and different levels of government. So you need some entity to be accountable for that coordination issue if you're going to make it work on a long-term basis. The meso level, making policy changes really requires resources and opportunities. I mentioned champions a lot, personal experiences. Timing is really sometimes critical, as Ron pointing out. Funding and technology and partnerships and trust, all kind of really key themes at the meso level. On the micro level, change requires changing people's beliefs, including the policymakers. So personal experiences that people see firsthand, stakeholder engagement can be powerful motivators for change. And that's it. Thank you.